What are the psychological effects of torture? What are the psychological effects of torture? This is a question that digs into the heart of human experience and morality. Torture has severe and lasting impacts on those who endure it, affecting their mental health in profound ways. From an ethical standpoint, these effects highlight the serious harm inflicted on human dignity, which is why torture is condemned across different cultures. One of the most common psychological outcomes of torture is post-traumatic stress disorder, often referred to as PTSD. This condition brings about intrusive memories, flashbacks, and nightmares. Survivors may find themselves reliving their traumatic experiences, triggered by reminders of their pain. This can create a cycle of distress and fear that is hard to escape. Alongside PTSD, many survivors face depression and grief. They mourn not only the trauma they experienced but also the loss of their previous sense of self and security. Feelings of guilt and shame often complicate their emotional recovery. Survivors may struggle with anger and distrust, especially regarding issues of justice, which can lead to social isolation. Cognitive difficulties are also common. Survivors may experience problems with memory and concentration, making it challenging to function in daily life. Physical health can decline as well, with issues like poor appetite and sleep disturbances often linked to their psychological trauma. Certain types of torture can cause specific psychological harm by targeting cultural values and personal fears. For instance, torture that threatens a person's sexual identity can lead to intense psychological trauma, as these fears carry deep social significance. The relationship between physical and psychological torture is significant. Physical pain can trigger psychological distress, reinforcing anxiety and flashbacks. Research shows that the brain processes physical and social pain in similar ways, which can intensify the overall trauma experienced by survivors. The long-term effects of torture can last 4 years or even decades. Survivors may continue to experience trembling, fear of violence, emotional pain, and sleep problems. While some individuals may gradually heal over time, many carry the scars of their experiences throughout their lives. From an ethical perspective, these psychological effects illustrate the violation of human rights inherent in torture. Even when cultural views on punishment differ, the universal psychological harm caused by torture challenges any justification for its use. The lasting mental damage emphasizes the moral need to reject torture and to provide compassionate care for survivors. Understanding these psychological effects is essential for developing ethical policies and treatment approaches. It supports the creation of mental health services that cater to the complex needs of survivors. This includes therapy focused on trauma, social support, and measures to help restore trust and dignity. Recognizing the moral weight of the psychological harm caused by torture strengthens global efforts to prevent it and uphold human rights.